As I said earlier, I've enjoyed exploring different topics within the world of LHON to help create accessible content for our community. But the topic of migraine holds a particular interest for me. While I don't have an LHON mutation, I do experience migraine myself. Migraine is quite common in the general population, so it's not surprising that I myself or anyone with LHON experiences it. But migraine is so much more than a headache. You may notice that I'm saying migraine and not a migraine. And that's because it's actually considered a neurological disease by many professionals that can even have a genetic component to it. Given that both LHON and migraine are neurological diseases and that many in our community suffer from migraine, as we were just hearing from Dr. Chiamarello and Dr. Grootman, it seemed an important topic to educate our community on. So first, I just want to describe what a migraine attack actually looks like for many people. The Mayo Clinic describes it as a headache that can cause severe throbbing pain or a pulsing sensation, usually on one side of the head. It's often accompanied by other symptoms such as nausea, vomiting, extreme sensitivity to light and sound. And migraine attacks can last for hours to days, and the pain can be so severe that it interferes with your daily activities. So is there a connection to LHON? So most LHON research in clinical care is focused more on vision loss and is done by neuro-ophthalmologists who may not be investigating non-vision symptoms necessarily. And a connection has not been fully proven in any way, but a very high percentage of those with an LHON mutation, whether they're affected or not with vision loss, experience migraine. For example, in an unpublished study of LHON in women, 55% reported migraine. But what does the research say? LHON, of course, is a mitochondrial disease, and there is some research that indicates there's a connection between mitochondrial disease and migraine. Most LHON investigations focus on those who are affected, so about 75% are male, overlooking female LHON carriers who don't have vision loss, but who often report migraine. So while there are some parallels in the literature on mito disease and migraine, it's been largely left out of LHON research. So of course, more research is needed to explore the relationship between mitochondrial disease and migraine more broadly, and more specifically, LHON and migraine. So what are the next steps for assessing and understanding LHON and migraine? Of course, we need to continue to investigate this relationship, as I said before, but we really need to educate. And that education needs to be evolving to always reflect the best available evidence at the time, as is true, of course, for all of our educational materials that we're developing. In terms of investigating, we want to see, is there a connection between LHON and migraine, or even more broadly, migraine and mitochondrial disease? There are hundreds of people in the LHON community who could be studied to explore a variety of hypotheses about migraine and LHON. And the exploration of beneficial and potentially harmful treatments for those with an LHON mutation would be very valuable to investigate. On the education side of things, of course, we want to let people know that there may be a connection between migraine and LHON, or migraine and mitochondrial disease. It's really important for folks to be aware that it's always beneficial to see a mitochondrial disease specialist in general, but even specifically if you're experiencing migraine. There are also professionals out there who specialize in headache, which can be broader than migraine. It can include other types of headaches, and those individuals might be really helpful in helping you manage your care. There are several prescription drug, non-prescription drug, and non-drug treatment options available to prevent and treat migraine. But always, we recommend that when meeting with any medical provider, whether you're affected with vision loss or not, it's really important to remind them that LHON is a mitochondrial disease, kind of like what James and Elizabeth were speaking to earlier. So much like the Charles Bonnet syndrome handout that we were talking about before, we have a new LHON and migraine handout. And as I said, we need to constantly evolve our educational materials to reflect any new learnings. But for now, we don't know a whole lot about the two. So what we do know, we've synthesized together in this handout. It's available in the UMDF app in the family syllabus section called LHON Saturday Science Migraine. We will also be making that available on LHON.org following the conference. There are so many resources out there to support you. You can find a mitochondrial disease specialist near you, going to mitonetwork.org. You can look for a headache specialist near you. The American Migraine Foundation has wonderful information about new treatments. You can also follow the latest in migraine research every year by attending the Migraine World Summit. It's a wonderful virtual event that I've attended a few times and learned so many great things. I wouldn't be surprised if they have talked about migraine and mitochondrial disease before or will in the future. And there are a variety of other resources, all of the ones I've mentioned and others included in that handout. So I'll leave with a quote here. This is from Dr. Matthew Robbins, who presented at the Migraine World Summit this year. And he said, "You have a legitimate inherited neurological disease." And I think it's a great quote because it applies not only to LHON, but also to migraine.